It's your host, Dr. Janice Castro. On today's episode, we have Dr. Yanira Hernandez, a licensed clinical social worker who will talk about her experiences having worked in the school systems, helping Latina families and children by providing psychoeducation and empowering children and families to advocate for themselves as they navigate mental health concerns such as ADHD. So, Dr. Yanira is a bilingual, bicultural Latina therapist serving the Latinx community in California via telehealth. She is the founder of Palante Therapy Incorporated with her gente in mind. Fueled by her lived experiences as a first-generation Latina, she specializes in helping BIPOC individuals with an emphasis on Latinx communities heal from generational wounds and find meaning and joy. Her services include individual therapy, immigration psychological evaluations, femtorship coaching to Latina students and recent graduates in mental health related fields, and speaking engagements as well as consultations. Thank you so much for being here.
Yeah, thank you so much, Doctora. It's really a pleasure to be in this space and just share just like my insights. So thank you. Thank you so much. Muchísimas gracias for inviting me. And I'm excited to get into our conversation today. So
yeah, I'm excited too. And please feel free to just call me Janice. I recognize we are both doctoras and we can always use that to recognize the hard work that we put into getting a PhD. Yes. But you can definitely call me just Janice.
Got it.
So I want to start off with my first question, which is, what challenges do Latina children and families face when trying to access ADHD care and understanding the assessment process?
Absolutely. And I think that's a great question. And as you mentioned, Janice, is a huge component is this aspect of stigma, right? Seeing children and families in clinics and also in school systems, I've definitely see how it comes up, right? Especially within the Latina comunidad. Obviously, just like any community, we're not monolithic. There are a variety of different lived experiences. At the same time, there is this commonality of stigma with mental health services. And I think anything that implies psychological services or needing support, right? And one of the things that I've seen is the stigma of if I receive additional support, specifically mental health support or psychological services, that implies that something is wrong with my child, right? And oftentimes, a lot of our parents that I worked with sometimes internalize that too. I'm not good enough of a parent because something is wrong with my child, right? And so those were one of the things that I came across not in the clinics and also in school systems. And also this part of the stigma is just not wanting that their child is tan locos, right? It's something that we hear very often, like my child is not crazy, right? We associate with mental illness, mental health with crazy. So that is something that comes off a lot. And I find myself prior to providing any type of services, particularly with the mental health and psychological services, is providing psychoeducation, right? It's understanding where that stigma may come from, right? And also providing a lot of psychoeducation and informing parents. I understand this is hard to digest, right? It's a lot of information. And also this is going to help your child succeed, not only academically, but socially, in relationships with friends, at home, with family members, and ultimately just be successful even after K through 12 education. So for sure, I think that is one of the biggest barriers. Another thing that I've seen too is language, right? Oftentimes there's that language barriers where providers may not speak the language, and that sometimes can interfere with parents accessing adequate support. One of the things that I've heard is when parents say, hey, I went to my child's primary care physician, and I was unable to really articulate what I was trying to tell them, my concerns about my child. So sometimes they get a misdiagnosis or underdiagnosed or no diagnosis at all. And it takes time for them to navigate in order for them to get the adequate services. And oftentimes it's not until secondary schools, meaning like in middle school or in high school, when they could have gotten that assessment or those early interventions since primary schools in like elementary or even before that. So I see a lot of those barriers. One of the things specifically I think that comes up for me with ADHD is that a lot of the symptoms too can also be misinterpreted by families. Oftentimes what I've seen is, mi hijo tiene mucha energía, pero así es. Like, that's how my child is. He's very energetic, but it's him. It's part of a personality. So maybe not really seeing the behaviors as something that could be just further assessed, or just the interpretation sometimes gets a little gray there. And that oftentimes I've seen it happen with a lot of the families, because for some reason it makes it more okay if I believe that is just my child's personality of just being very energetic or very inattentive, así es, as opposed to me getting mental health support services or psychological services. So there's definitely a lot of different barriers, but I think those are one of the ones that I have mainly seen in clinic settings and also in school systems.
Yeah. Wow. Thank you so much for all of that insight, because as you talk about the stigma that shows up with parents feeling concerned that either there's something wrong with my child or there's something wrong with the parenting that I do,
Right.
that creates so much shame, right? And then to
Absolutely.
get past through that shame and guilt of, did I do something wrong, or is there something wrong with my child? It's really hard to ask for help and be open to the help
Mhm.
if we have that much shame around it. And then you brought up also how there's these language barriers that come up a lot within our comunidad. And I think about how it is such a privilege to be able to provide support in Spanish,
Mhm.
because then it allows more of our community to be able to get access to the understanding what's happening here, right? Like you
Mhm.
mentioned, if they go to the doctors, they may have a hard time communicating
Yes.
what it is that they're needing. I recently went to the doctors like a couple weeks ago for my yearly just physical checkup. I didn't feel like there was anything wrong, but you never know, right? And
Right.
so when I went, it was an interesting experience, because during that first appointment, one of the questions that really stood out to me, there was like, so no anxiety or stress higher than normal? And I was like, how am I supposed to know what's normal? And why are you starting the question off with no stress, no
Mhm.
anxiety? Like,
Right.
like, how does that even open up the conversation for me to say, actually, there is
Right.
concerns, and what
Right.
does a normal level even mean? And that was
Exactly.
me talking in English, right? Like, how are you going to do that when you're speaking Spanish with somebody who may not necessarily understand the language that well?
Absolutely. And oh my God, I just want to validate that experience, especially when it comes to navigating healthcare, because
Mm,
a lot of the times it's these terminologies of, and when you know there's something's off, or you want to question, or you're concerned about something, does that mean I'm not normal? Is something wrong
yeah.
with me? And I think that often also can be a barrier for parents to ask for support, because I don't want to seem like I'm not normal. I don't want to seem like that I'm abnormal or something is off. So it's with language. I think that there's also needs to be some changes happening in the way that we provide information, and especially within our healthcare. And of course, that includes mental health. Absolutely. And that happens to us, that we have the language and we have the expertise. I can only imagine for families that are monolingual Spanish speakers, that are immigrants or undocumented, that maybe are already feeling afraid of accessing support because of fear of judgment and shame. And that just only exacerbates those feelings of shame and guilt, and not wanting to access appropriate care.
Yeah, exactly. And I think about how you also highlighted that within our community, sometimes parents will overlook ADHD symptoms
Mhm.
as así es, whatever symptom it is, whether it's that they're traviesos or they just have
Mhm.
a lot of energy
Right.
or son flojos, and that's just the way that they are. It continues to perpetuate that. No, that's just how they are. We don't need to change anything. Unfortunately, that's just a weakness or an area of growth. And so it can be really hard if we just start to normalize it as a personality trait and just say that's just their
Right.
personality when really there's more to it.
Absolutely. And I think it's important we're not saying that we're going to pathologize right away and say, oh, that's ADHD or that's this or that's that. At the
Yeah.
same time, it's just coming from a place of curiosity and
Mm.
just be like, I'm noticing that my child is always energetic at home and it's always doing this, like noticing little behaviors so that when you're at school, you can also ask those questions. I'm wondering if this is also happening at school. And so coming from a place of curiosity is something that I always try to inform parents because yes, we don't want to also over pathologize and say something is wrong. And because no, it could be that maybe it is they have some sort of more energetic personality, and that is okay. At the same time, we also want to be curious and observe all behavior because ultimately that's going to provide more input when these assessments and evaluations are being interpreted.
Yes, which leads me to the next question. Can you share what does support look like for parents when you are at a school? What can a parent expect from a social worker in terms of support? Let's say there is a parent who's okay, I'm open to seeing maybe there's a little bit more to my child having too much energia.
Yes, great question. And I do think that in schools, especially K through 12, right, there's so much that we see on a day to day, right? And oftentimes directing the parent to the right person can be difficult, right? Because we can all support, but in many different areas. And usually when a parent comes to me or as a school social worker, when I was in a high school, when parents come to me and say, hey, you know what, I'm open to learning more about services. I'm noticing these behaviors about my child. So it's really just one listening, really to trying to identify what are the concerns of the parent, right? And also really quickly taking a note, is this something that a parent can benefit from exclusively just mental health services, depending on what they're sharing? Or maybe this is a parent can benefit from mental health and also psychological services. And this is where having multidisciplinary teams really help, right? I am the was when I was in schools, I was the type of person that I was like buddies with everyone because we all need support. We all need to support each other and we always work collaboratively, right? So
Yeah.
I feel very fortunate that I had a great experience working with school psychologists. And so every time we would tag team and consult, right? Hey, I'm noticing I saw this student or I saw this parent who expressed these concerns about the student, and there may seem like they can benefit from mental health services and possibly psychological services. And so then we would just share information. And then oftentimes I would give parents a brief psychoeducation on what the IEP process is and the 504 plan and what kind of accommodations and modifications look like in a classroom setting.
Mm.
And often, so just planting the semillita, planting the seeds. So by the time my partner, the school psychologist, would get in contact with them, hey, Dr. Hernandez shared that they had some concerns. I'm happy to discuss any of your concerns that you may have or information you want to know more about IEPs and 504 plans and assessments. And then she would just provide those further, more comprehensive information about how to navigate those assessments. So it really just depended on the level of support that they needed. But I would say they were always hand in hand. And one of the ways that I also supported students is I did a lot of consultation work with teachers. That
Mm.
is one thing I never shied away from because I wanted to validate that for teachers, right? They have 20 plus kiddos in their classrooms and it can be a lot. And right, especially if you are in an under-resourced school, that it's in a community that is also under-resourced in a system
Yeah.
impacted. Like I was in the school, predominantly Latina students, immigrant parents. We had a lot of newcomer students. So my role, I took the time to really try to figure out how was the teacher's way of teaching of method and how they connected with students, and then also provide input. Hey, this is, I don't know what are you noticing in the classroom with this particular student? And do you notice it all the time or just only specific interactions with peers. And then I said, okay, I'm hearing you. And maybe this is one way that you can support the child where it won't take too much time, right? As educators and teachers, right? They have so many students that they're seeing that is like just the nuggets of interventions that you can provide and support. I was like, this is what you can do. And I'm also going to provide this feedback to our school psychologist so she can later consult with you in case the student needs an IEP or a 504 plan. So then I did a lot of consultations with teachers, but I always made sure that my approach was very, very collaborative. Like this is this is a team because we're here to support the student, especially if a student it was more than just inattentiveness, right? With ADHD, it was also other behavioral issues that those tend to be always at the forefront, right? Before we can diagnose, it's always the behavioral, like they're not paying attention, they're getting sent to the dean's office, right? Or just any type of behavioral concerns. Those were usually the reasons why they were referred to me, but ultimately it's just okay, there may be more than just the behavioral issues. Let's go ahead and address them together, and this is the way that I'm going to support, and these are some skills or maybe some techniques that you can use in the classroom to support the student. In the meantime, I'm going to do it on my back end and collaborate with the school psychologist, the academic counselor, and see how we can support the student. So it's a lot of collaborative work that gets done on our end to provide a kind of a more comprehensive support for the student.
Yeah. Wow. Wow. So much work that gets done within these schools, especially your role as when you were at the schools. Shout out to those social workers because that's a lot of work. You're over here talking to the teachers, trying to give feedback, but also trying to get more insight on the student to see what's going on, collaborating with the school psychologist, trying to figure out these 504 plans, IEP plans. I don't even know what those really are too much. Those are for trying to figure out what kind of support the students need. Is that how that works?
Yes, absolutely. Great question. So let me go just briefly explain what an IEP and 504 plan is. So an IEP is an individualized education plan or program. So it really details like specific modifications for students who have a disability. And this can be other health impairments such as ADHD. It could be social emotional. It can be perhaps any physical disability. So it's just acknowledging that this student needs further support, and the IEP it's a legal plan, and the entire school system needs to abide by those modifications that were identified by the team. And the team is composed by a school psychologist, by the special education teacher, or the general education teacher, by the counselor. There's usually an administrator also in those meetings. There is the parent, the child, so any advocates that the parents may want to bring, right? So it's a legal plan that says my child is authorized to receive these accommodations in the classroom and outside the classroom. And then a 504 plan is accommodations that they're receiving, but in general education. They're not considered they're being in special education. So it's a little bit differently. So for example, if a student just needs maybe the student needs a longer period of time to take an exam, or maybe the student needs to sit in front of the class in order for them to help them to pay attention and complete their assignments. So those accommodations can be made with the 504 plan. But you're still in general education. You're still in with the rest of the students, right? In IEP, you can still be within the classrooms of like general ed, but also you have this individualized plan that specifically details certain accommodations, implementation of services that are going to be done. So it can be, I also want to note, I know that I painted it really colorful with the collaboration with a lot of the school staff. It can also be very difficult for parents to navigate that, because you're not just working with school staff. It's like sometimes it's the entire district, right? And if the parent, maybe there is like fear of advocacy, right? Or not knowing how to navigate systems, it can feel very intimidating. I saw so many parents often tell me, like, I trust that you're telling me the truth, or I trust that so and so is telling me what I need to do. It's guiding me in the right direction. And oftentimes it's sad to say, but sometimes like there's this district demands, system demands that prevent oftentimes from parents doing what they need to do. I always tell parents, I'm like, you know what? You go out there and you fight and you advocate for your child. So maybe I shouldn't be saying this because I work
Why
for
not?
because I work for the school district, but you go ahead and you ask who you need to speak to and
Mm.
you write everything down to make sure that you know who you're speaking to and what they said. I was always a huge advocate and for parents, especially for our gente who had those language barriers, who didn't know how to work the system. I said, no, I'm like, you don't need to sign this if you don't agree. If you have questions, you go ahead and ask the school psychologist, you ask someone that can provide further information to clarify. So by the time that you sign it, you're saying like, you know what? Yes, this is the plan that I want for my child. So it's always, I really try to empower a lot of our parents to really advocate for their needs and the students as well. Is if you
Yeah.
feel like there's an accommodation that you have and if it's not being respected by the teacher, oh, you let them know. You remind them that you have that IEP. Right. And this is why I say that I feel very blessed that I had wonderful school psychologists that I came across because they were always like, yes, let's go advocate and let's remind this teacher that our student has this IUP or has this accommodation with a 504 plan and needs to be respected. A lot of the times it just really was empowering the parents
Mm.
to advocate for their child and also empowering the students, especially those that were juniors and seniors who were a little bit older and felt a little bit more empowered to speak up. But yep, you can go ahead and ask.
Yeah, for sure. I really appreciate just hearing the ways that you encourage parents and children to advocate for themselves because at the time you were working for the district, part of doing the work that we do in our field is being able to also educate people that hey, like you have rights too, and you can speak up and you can ask questions and be
Mhm,
curious, and you are not forced to sign something that you do not want to sign. And so
mhm.
often, like you said, because parents go into it with some fear, feeling
Right.
intimidated because there is a hierarchy and there's also fears, like especially with our immigrant communities. What does this mean? Especially because when you come from a background of being undocumented, you get scared to even speak up or advocate. And I just want to just praise you because I think it's so wonderful that you were doing that work. And I think about just how people with ADHD, I've heard sometimes, have been placed in the back of a classroom, especially when they didn't have the ADHD diagnosis, they get the late
Mhm,
diagnosis, or they
mhm.
just keep going to the principal's office and keep being
Yes.
told, like, if only you would apply yourself.
Oh
And
my
it is
God.
just so unfortunate that year after year they get these messages that gets ingrained in them. But it's people like you and the school psychologists and just the school systems who are there to try to support these students.
Right.
But yeah, the underdiagnosis shows up a lot in our community.
Absolutely. And the thing is, one of the things that I would also see is, especially being working at the high school level and when I work in the clinics and I work with the little ones, the young population, is oftentimes a lot of these behaviors or curiosity or concerns from parents are being known since earlier on. And oftentimes they get dismissed,
Mm.
right? It's just behavioral issues. Así no,
Yeah.
así es él. It's no hace caso, right? Or they're not being cooperative, right? And what happens is that these students internalize these labels
Yeah.
and begin to think, oh, I'm not good enough, I'm not smart enough, oh, I've never been a scholar. I used to call all my students scholars, and they're like, no, miss, I'm not a scholar because I'm not
Oh,
smart. And then when I would talk to them, they would tell me like, no, it's been like this since I was little. And I've seen it happen. I've seen it happen the way that students very early on in childhood just get labeled as traviesos or just having behavioral concerns without being officially assessed for services, right? And ADHD is one of them, right? And I do think that, which is why now as adults, many of us, because this is the line of work that you do, right, that are seeking kind of that validation. No, I noticed I had a lot of these things earlier on, but nobody
Mm-hmm.
paid attention to me. Nadie me hacía
Yep.
caso, right?
Yep.
And now we're now because we may have the means or have the agency to seek those services and support, we seek that evaluation, right? But and then I always sit back and say, imagine if this person would have received not only the diagnosis, but the support, the services earlier on in elementary. What a difference would it have made academically, socially, professionally, and then all aspects in their lives, right?
Mm-hmm.
So I often think that it gets dismissed very earlier on,
Yeah.
especially within, I want to say with a lot of marginalized communities, like a lot of like Black and brown students, because those
Yeah.
were the students that I predominantly work with. And a lot of them is like, oh, that's just how they are. A lot of like macroaggressions that were that drive a lot of these ways that our students are being labeled. So I think it's also important to know that a lot of the underdiagnosis and mid-diagnosis happen because there is no earlier intervention since early childhood, since primary schools.
Yeah, for sure. It is unfortunate that is so common within our communities because I think about BIPOC adults with ADHD tend to get overlooked with their diagnosis, which then leads to a late diagnosis of ADHD. And then once they get that late diagnosis on as an adult, there's this grief around how life could have been different if they would have gotten that support earlier on, just like you
Mhm.
mentioned. And I think about how in general, when there are those microaggressions coming up, the internalized racism that a lot of us sometimes unconsciously are unaware is even
Right.
happening because none of us are immune to that. And then just thinking about how these kids end up being sent to the principal's office, they keep getting suspended or detention, and then they get discouraged and marginalized within the school systems, and then how that contributes then to the school to prison pipeline, right?
Mhm. That
And
part.
yeah, I appreciate just you sharing a little bit about your experiences. And so I want us to transition to ask you also, what advice would you give to parents who think their children might have ADHD?
Yeah, and I think when different consejos come up for me, I think that one of them is like really just observing the behaviors and having that curiosity, right? And just really noticing what's coming up, right?
Mm,
Maybe at home, if they're just noticing at home, just have that curiosity and also to communicate that with the schools, right? And oftentimes the first person that they tend to communicate is with the counselor, right? And whether in this is, can be at anywhere in K through 12, right? Most schools have a counselor of some sort, right?
mm.
So just really saying, hey, I'm noticing these behaviors that are coming up at home. I'm wondering if there's been any concerns from their teachers that they're also being observed at school. So for sure, just communicating, it's 100% okay to communicate and ask for support. Or if you at this point you're not too sure the level of support that they may need, just ask and sit with that information, right? And just let it sit with that information and say, okay, I'm trying to get as much as information I can about my child so I can make the best informed decision for my child, right? Because that is okay. One of the things that I always told parents, you don't need to make a decision right now in this second as you're in my office. Because
Yeah.
oftentimes, because district mandates, we sign the signature right now. Well, say yes and link here, link there. I get that. We do want to link the families, but also I can also understand that I'm giving you a lot of information. I want you to digest this information, consult with whomever you need to consult with. Maybe it's your spouse, your partner, maybe it's with your family, because as we know in nuestra comunidad, nuestra familia latina, family systems are very important, right? And we consult among family members. Hey, school social worker or the counselor told me about these resources or services that are needed for my son, for my child. I don't know. I still have more questions, or let me do my own research. that is okay. So usually what I would tell the parents, let me educate you, let me provide you some ADHD resources, some resources on mental health, therapy, psychological services, plantando esta semillita, asking questions, and it's okay to sit with that information. And when you're ready to seek that support, come back to it. Oftentimes, when we work with a lot of working families that maybe don't have the time to give that phone call to the school social worker or to the counselor, one of the things that I would do is, okay, I'm going to give you a week and then I'll call you back. I'll call you within a week and we'll come back to it. And if you still need more time, that is okay. But just I want you to know that I'm here, right?
Mm.
So 100% is just knowing who you can speak to, right? Also at school, who are your allies at the school? And part of knowing your allies at the school is writing down every person you come in contact with. Because
Mm.
so many times I saw parents being dismissed because parents didn't remember who they spoke to. Because they would ask, who did you talk to? She'd be like, oh, well, I don't know. I think it was someone in the front desk, or I think it was like a consejera, right? But there's a lot of titles can be misinterpreted because many of us could do some sort of counseling, but we all have different titles, right? So I
Yeah.
always told parents, write down who you spoke with, what date or what time, and just a brief sentence of what you guys talked about. And then I had parents who would come with their list, which it was very empowering to see. And they'd be like, yo hablo con la señorita so and so, yo hablo con la señora from the front. And they would just go and have their list. So, oh, okay, I know who you spoke to. So then I can go and follow up with that staff member. And I think with that said, it's like being open to the collaboration. I know this is a lot of information that parents are receiving regarding their child, whether it's needing a ADHD evaluation, aka the psychological assessment for possibly an IEP or 504 plan, or mental health services. It's a lot, right? So
Yeah.
try to seek those support systems that you have at school or outside of the school, right? Because that's only at the end of the day, I think we all just want the child to thrive in school, right? And acknowledging that not every child has differences in learning and thinking in ways, right? There's this aspect of neurodiversity that is so beautiful, right? Because we're all very diverse in our learning, right?
Mm.
In our thinking. And embracing that sometimes can be difficult for parents, again, because of the stigma,
Hmm.
right? But just if we see it through those lenses, I know that when I would rephrase it like that to parents, they would sit with it and you're like, oh, okay. So that makes me feel better to think that my child just thinks differently. And I'm like, yeah, your child is an exceptional learner. Look, they're very bright, especially with kiddos who had an autism diagnosis. Look, like you look at the way that they do with X, Y, and Z. They're amazing, right? Their brain just thinks differently. They learn differently. And that is okay. That's very beautiful, actually. So just also even the language can be so empowering with our families, especially with our gente, right? Because there's still a lot of stigma with a lot of neurodiversity,
Mm.
right? Including ADHD and other neurological disorders. So I do think that just sometimes thinking about it that way can also feel more validating and empathetic, right, to their child.
Yeah.
And then one last thing, another consejo is for parents to also seek their own support
Mm.
system because oftentimes that we see navigating school systems, especially within special education, it is a battle for a lot of our parents. And like we acknowledged in the beginning, there's the language barriers, there are systemic barriers, and that can impact the parents' mental health. So I always tell the parents, like, busquen su apoyo, whoever it may be, maybe it's a comadre or a friend, una amiga who's going and navigating the same with their child, trying to figure out how to support their child because they're presenting with X, Y, and Z behaviors or academic challenges. Look for your allies because this is hard. This is hard for the parents and the caregivers to also navigate. And I always tell them, like, sometimes you can feel very defeated when you get no's or when you have a door closed, right? And you were really looking forward to it, or there's no more, there's a waiting list for a referral. So just really just seeking your comunidad of support because that's really going to come a long way. And also you can share resources. Maybe I loved the parents that I work with. So I loved when they shared resources among themselves because they'd be like, oh, yo conozco a una comadre que trabaja so. And they was just so adorable. And I felt that was a lot of power. And then a lot of them just really depended on each other for emotional support as they were navigating a lot of systems in schools. Yeah. Few
Yeah. Yeah.
consejos.
Yeah, no, those are gems. I really appreciate you bringing your perspective around the different things and tips that you can just share with parents who may think that their child has ADHD. And
Mhm.
it really helps to understand how being able to be open to the collaboration and seeking out support and writing down those names, taking notes. And so I think it's so wonderful to just have this conversation with you. So thank you so much. I do want to give you an opportunity to share with our listeners how can they be in contact with you and if you have any offerings.
Yes, thank you so much. Yeah, so you can find me at Palante Therapy. So as you can see, that's the name of my practice. Palante just holds a lot of meaning to being Latina, being a daughter of undocumented immigrants. And I always heard my mom say, mija, para adelante. So I think that term just holds a lot of meaning. So for sure, you can find me on social media. I love providing a lot of content and information regarding destigmatizing mental health, especially in the Latina community and immigrant communities. I do have offerings for individual therapy as I officially transition from the schools to full-time private practice. I
Woo
definitely have
woo.
some, yes, I definitely have some openings. I also do psychological immigration assessments and I do coaching. I do coaching for Latinas who are in the transition of either in graduate school or are early in their careers, who are just trying to navigate the different mental health fields or are looking into going to private practice or like the work that I do and want to learn more about it. So for sure, I have those offerings. And I do want to put in a gentle plug here, just because as we're talking about ADHD, I want to offer the resources from understood.org because those I've been just really trying to get those resources to a lot of our gente because especially because they're in Spanish,
Yeah.
right? And the amount of information that they have, I wish I knew about it more when I was in the school systems because I probably would have had I would probably had a workshop where I had all the parents just be like, this is how we use these resources. So I definitely want to shout out to Understood for providing those amazing resources. But I believe you had another resource that you shared with me the last time we connected with about ADHD. If you can share that one as well,
Yeah, yeah. I'll definitely
yeah.
include, I think it was Chad. I'll definitely include these resources in the show notes.
Yeah, awesome. But ultimately, muchísimas gracias, Janice. I really appreciate you reaching out for this episode because as my corazoncito, I feel like I still consider myself an educator, school social worker at heart. And this is a lot of the passion that I have supporting our gente, our families. And so I was really happy to hop on this and just really share some nuggets of information. And hopefully our listeners can really just find it resourceful at the end of the day. So, muchísimas gracias.
It was so wonderful to have Doctora Yanira Hernandez as a guest on Latine ADHD podcast. If you are someone who specializes in ADHD, neurodiversity, or maybe you are someone who was diagnosed with ADHD, you identify within the BIPOC community and you'd like to share your story, fill out the Google form in the show notes. And just a reminder, this is not a replacement for therapy. However, I do appreciate y'all listening. So thank y'all so much.